So for the setup for the maternity massage, we're going to pull the sheets back. This is the maternity bolster. This is the top that has the arm holes. The bottom is the flatter side. I'm going to put that there. So depending on how far along your client is, has Velcro that can spread out further or move closer in if they are not so far along in their pregnancy. The goal is you do not want your client's belly to be pressing against the table. We're trying to keep as much pressure off the belly as possible. For the face rest, it just sits right on top of these Velcro pieces. Make sure that it is secure. And place the cover over that. Once you've done that, you can cover the bolster just like you normally would when you're dressing your table, and just make it look nice for when your client comes in. Okay, so with your maternity client, you will bring them in and ask them, have you ever used a maternity bolster before?
No, I have not.
Okay, so this is her first maternity massage. So what we're going to do is we're going to show her what she's working with so that she's not nervous. At the same time, we're going to assess how far along she is. We're going to ask her how far along she is. We're going to look at her and kind of talk to her and see if this is going to be a good fit for her. If we need to adjust it, we will adjust it now. Kind of estimate the best you can and go from there. If you've established that she is far, like 8-9 months, and she's really showing and you need more lift, there are wedges that go underneath this that we can put in to give it more lift. Okay, if you need the wedges, these two are for the side. They've got a slant. They go tucked in to elevate the middle part a bit more for your client. Again, we are trying to prevent their belly from having too much pressure up against the table. This front one goes in the front to keep them level so they don't feel like they're falling forward. So when they are going to lay on this, you're going to explain their belly goes in there, their arms can hang off the side in these arm wedges, and they will just climb into the table. It's a good idea to lower your table before they get on, because they are uncomfortable already and it might be hard for them to climb up onto a really high table, and this gives it much more height. So lowering the table will make it a lot easier for your client to get on. Make sure that you ask your client if they have any questions or any concerns regarding this, and then do your regular intake as normal. Once your client is on the table, make sure that they are comfortable and level. You'll want to fix this ankle bolster so that it is properly supporting their ankles, and ask them, are you comfortable?
Yes.
Is there anything I can adjust for you?
No.
Okay. Also be aware of the heat on your table. Sometimes with our maternity clients, the heat can be overwhelming because their body temperature is a little bit harder to regulate. So it might make them feel sick if it's too hot. So make sure that you ask them, you know, how's the temperature of the table?
It's cool.
Okay, thank you. Throughout the massage, make sure that you are double checking on your client with pressure. You can do deeper pressure up in their upper back and shoulder area. When you're down kind of in their more pelvic region, You can do firm pressure, but make sure that you are not going too deep in that area. And always communicate this with your clients so that they know what to expect. Communication with the clients goes a really long way, and it helps them understand why you're doing what you're doing.